They're some of the most vulnerable victims of the pandemic.
Probably like one of the most heartbreakingest things like a mom would have to go through.
Children, some only months old, clinging to life in hospitals overwhelmed with COVID patients.
It's so scary.
ICUs at the brink, many with children not yet eligible to be vaccinated. All of this as millions of kids start heading back to school, generating a political battle over face masks and vaccine mandates.
I want the school districts to stand up against the governor.
Faith over fear. There's only one man in control here, and it's God.
Parents now pushing for more protection for kids, wondering just how safe it is to send their children to school. Everything you need to know and all of your questions answered with NBC News Now in Focus on children and COVID. And good Thursday, everybody. I'm Aaron Gilchrist. Thanks for joining us for this special program, NBC News Now in Focus, Children and COVID. Over the next 30 minutes, we are putting a spotlight on the dangerous spike in COVID cases in children, much of which is fueled by that highly contagious Delta variant. Let's start, though, with a dose of hope. U.S. Surgeon General Vivek Murthy says the first COVID vaccine doses for kids under 12 could roll out by the end of the year. Here in the U.S., there are roughly 50 million children under 12 years old. But that vaccine is not coming soon enough. Children who early on were thought to be virtually immune to COVID are filling up hospitals from coast to coast. Just last week, more than 94,000 children were diagnosed with COVID. That is more than double in just a matter of weeks. In Memphis, Tennessee, at least 3 children have died from COVID complications in just the last week alone. The timing of this latest surge could not be more concerning. Millions of kids are back in school or will be in the coming weeks. But a debate over whether they should wear masks has many parents divided and some just outraged.
We know who you are. We know who you are. You can leave freely, but we will find you, and we know who you are. We know who you are.
That tense encounter unfolded just this week in Franklin, Tennessee, after medical professionals urged the school board to enforce mask mandates in schools. Tennessee is just one of dozens of states where there is no mask mandate for schools. Many districts are taking it upon themselves now, and they're defying their governor's orders by enacting their own mask mandates. The reason for the pushback? No state in the entire nation is seeing less than a 25% increase in COVID cases over the past 2 weeks. All the states in red you see here are seeing cases surge by at least 100%. We have a team of correspondents and doctors standing by now with everything you need to know about COVID and children. NBC News health and medical reporter Erica Edwards is first up here. Erica, let's start with what I think is a burning question for millions of parents across this country. Right now, we know there are roughly 50 million kids under the age of 12 who are waiting to get vaccinated. The Surgeon General says that could happen by the end of this year. Talk to us about the process to get us there and where things stand in that process right now.
Hey, Aaron, good afternoon. So my sources do agree with Dr. Murthy that we don't anticipate seeing a COVID-19 vaccine for children under the age of 12 until late fall or even mid-winter. That's because drug makers split up the research. One cohort is ages 5 to 11, then you have the 2 to 5-year-olds, and then finally ages 6 months to 2 years. And that's really because children need different doses. They cannot have the same dose as adults do. They're not just simply mini adults. Now, Pfizer has told us that they anticipate having data on the 5 to 11-year-old age group by next month, with findings on the younger children rolling out the months after that. I talked with one of the principal investigators of Moderna's KidCove trials this morning. He said he also anticipates about the same timeline. And while many parents are eager to get their young kids that vaccine, it takes a lot of time to crunch those numbers, and it's going to take time even after the companies file for emergency use authorization for the FDA to really sift through all of that data. Aaron?
Erica, there's this debate now over whether kids should wear a mask when they're in the classroom. It's a hot-button issue all over the country. I want to play some of what Dr. Anthony Fauci recently said about states relaxing restrictions.
If you want to keep them in school, you really got to do whatever you can to keep them safe. And what that really means, in my mind and in the mind of public health officials, is the first thing you do is that you surround them with people who are vaccinated.
And he's largely talking about teachers and folks who work in the schools. We know California is the only state right now that's mandating that teachers be vaccinated or undergo regular testing. Any indications at this point, Erica, that more states might follow suit with that?
You know, Aaron, time will tell, although there is a growing momentum for vaccine mandates among teachers. Hawaii, for example, recently said that all public employees will need to be vaccinated or get regular testing. That includes public school teachers. California took it a step further. That mandate includes even private school teachers. Meanwhile, some schools are, in other areas, some school districts are embracing other mitigation measures to keep kids safe this school year, despite what their state leaders are saying. Dallas County in Texas, for example, has reinstated a mask mandate in its schools, despite Governor Greg Abbott banning masks in schools. Aaron?
And we're going to talk more about masks in schools in just a little bit here. Erica, we're right there. Flu season is right around the corner. For a second time, it will sort of bump up against the coronavirus pandemic that we're dealing with. What are you hearing from doctors? Are parents sort of comparing COVID and the flu right now?
Right. Let's be clear. Both COVID-19 and the flu fortunately spare many children. However, severe illness, hospitalizations, even death, sadly, can happen, although that they are rare. But I got to tell you, infectious diseases doctors I've spoken with say that they are more concerned about COVID-19, and here's why. Flu has been circulating in this country for decades. Mm-hmm. We have a flu vaccine approved for everybody over the age of 6 months. And over time, that really does give more immunity in the community to help protect those children against influenza. COVID-19 is brand new. It has not been circulating. We don't have a good understanding of all of the impacts on children. And there's no vaccine, of course. I talked with an infectious diseases doctor who's been treating very sick kids for over 30 years. She told me, Aaron, that she has seen about the same number of kids severely ill with COVID-19 in just this past season as she has over 30 years treating severely ill kids with flu.
Wow. It's important to understand that perspective and the science behind some of the responses we're getting. NBC News health and medical reporter Erica Edwards. Erica, thank you. Let's bring in NBC News senior medical correspondent Dr. John Torres now. Dr. John, you have been covering this pandemic since the very beginning. You've been digging into the details on these surges that we've been seeing over the last year and a half. In your mind, what's the most important thing? What's the number one thing that parents should know about this latest spike in cases that we're seeing, specifically in children?
And Aaron, I think it's the same thing that parents should know throughout the whole pandemic, but now even more so because of this Delta variant. And what I frequently tell them is, yes, if you look at the studies, if you look at the information, children are less likely to get COVID, they're less likely to get sick from COVID, and they're less likely to get hospitalized or die from COVID. But that doesn't mean they're not going to get it, they're not going to get sick, and they're not going to die from it. And now with this Delta variant, that makes it even more important. And here's what we're finding out. If you think about it, about 5 weeks ago, we were down to 10 to 11,000 cases a day. Now we're over 100,000 cases a day. So we've had 10 times the number of cases. And even though the Delta variant we know is more contagious, it's more contagious for children as well. And so that means those children's numbers are going up. That's just a mathematical issue. And that's why you're seeing the ICUs filling up. That's why you're seeing the children's hospitals filling up, because more kids are getting infected. The more of them that get infected, the more of them are going to get sick from it. The more of them are going to get hospitalized. And unfortunately, the more of them are going to die from it as well, Aaron. So the important thing to realize is it can affect children. They cannot be vaccinated below the ages of 12 yet. So it's behooving upon us to make sure that we protect them.
And Dr. John, even as we look at the reality of what's happening to kids in hospitals right now, there are still a lot of parents who are pushing back against the idea of a mask mandate in classrooms. They say there's no science to support that. What's your perspective on that? What would your response be?
My main response would be that this is a big public health initiative. And as doctors, as scientists, as researchers, we're just pushing out the public health information because we want to protect everybody, including the children. And I would also say, make sure you're looking at the appropriate science. Make sure you're looking at science and you're not just looking at a pundit that's talking about something that they think about or possibly heard about from a different pundit or maybe from the internet source that doesn't really have anything behind it. And if you look at the science, especially in areas where mask mandates were put in place, you'll see lower death rates. You'll see lower case rates on top of that. Plus, if you even look at research of what the masks are doing just in general, they're protecting people from getting this virus. And what I frequently tell them as well is, you have to remember, the main purpose behind the mask is to protect other people from you in case you get sick. But having both people masks means that you're protecting each other. And that's the important part here. And that's why it's important for children in particular that they're around people that are vaccinated and masked in order to protect them.
Yeah, really important detail there. Before I let you go, I want to ask you, what do you want parents who may be on the fence about getting their children vaccinated, the kids who are now 12 and older and eligible to be vaccinated, what do you want them to know about being vaccinated?
I want them to know a couple things. Number one is once they get vaccinated, they're going to be able to do more things. And as time goes on, like Erica was talking about, there's going to be more of these mandates, and vaccines are going to allow them to do more things. And that's the convenience aspect of it. But the health aspect of it, as a parent, our main point is to make sure our children grow up healthy and happy. And part of doing that is making sure they survive through childhood. Vaccines can help them do that because this is a deadly virus that is out there. It's a virus that can affect them. And the last thing you want is for them to get sick and for you to say, I wish they'd gotten that vaccine.
All right, NBC News senior medical correspondent, Dr. John Torres. Dr. John, thank you. Now, the pandemic has taken an especially tough toll on students, many of whom are too young to understand the gravity of the situation we're dealing with and why they can't simply hang out with their classmates like they used to. In Shelby County, Tennessee, schools are back to 100% in-person learning. The superintendent there, though, is going against the governor by rolling out a mask mandate. Here's NBC News Now correspondent Maura Barrett.
Back to school this week for Tennessee students.
Together we must believe, together we will achieve.
The first time in 18 months. Dr. Joris Ray cheering on his students here in Memphis, fully masked as they arrive for their first day.
My freshman year was completely virtual, but now I can meet them, I can see them, put a name to a face, and we can actually come together. We have seen each other in person before, but it's just good to be back.
And worth it even with the masks on?
Yes, it's going to get taken some used to, but it is good to be back even if you have to wear the mask.
The kids put in the middle of a political battle. Shelby County schools issued a mask mandate despite Republican Governor Bill Lee's stance against masks. On the other side of the state, they're back to school with no masks, no restrictions, and already 50 positive cases with nearly 200 students in quarantine.
We're starting to see an uptick of the number of positive cases both in our students and our employees.
The Shelby County superintendent holding firm against political pressure.
At the end of the day, I'm an academician, not a politician. Tennessee Code annotated talks about safety first, wearing masks, keeping our students safe. That's what we're going to do. The governor and I, we have a great working relationship, possibly disagree on the mask issue, but that's okay. Right here in Memphis Shelby County schools, our students wear masks, but the governor does understand this is a local decision. And right now, our numbers are in triple digits. In the state, the numbers have increased by over 200%.
And as those case rates rise, 24% of new cases are among children under age 17. What's more, pediatric hospitalizations across the state have risen 65% in just the last week. Doctors looking at the fact that only 37% of the community is fully vaccinated.
So our vaccination rate, unfortunately, is not where we want it to be here in Shelby County and the surrounding area. So I think that's fueling the Delta variant. So we're seeing kids come in with respiratory illnesses, cough, shortness of breath, needing supplemental oxygen on our respiratory floors, and then unfortunately some of them needing to be intubated and in our intensive care area.
In July, the local health department was ordered temporarily to stop vaccine outreach to minors after state Republican pushback. Now, Le Bonheur Children's Hospital accounts for half of the serious pediatric COVID cases statewide. 2 children died from COVID complications just in the last 2 weeks. The state health commissioner warned children's hospitals could be full by the end of this week. Parents in Memphis thankful and supportive of the mask mandate.
I mean, I'm really excited the kids are back in person. I'm glad that they're doing masks. My 12-year-old's vaccinated. My 10-year-old is not. And so, yeah, that is a concern for me.
The students willing to do whatever needed to stay in person.
At the end of the day, so you'll take that little inconvenience of having a mask on just to still be in the school, because virtual is a struggle. I'm going to take every minute and make it count for my senior year.
I'm sure it would be a bummer to have to go back.
Oh, yes, very much so.
Maura Barrett reporting there. With pediatric COVID cases on the rise in Tennessee, we're starting to hear from parents about the severe bouts of COVID their children are experiencing. Let's bring in NBC News correspondent Kristen Dahlgren now to talk about this a little bit. Kristen, you know, it's the personal stories that really resonate with a lot of people. Some people not so much, but a lot of us do hear these stories and are heartened. I want to talk a little bit about this woman you're reporting on, Mirsada Merrick, and her daughter, a 9-year-old daughter, who ultimately ended up hospitalized with COVID-19. Tell us about their experience.
Right, Aaron, and I think it's so important to note, we can talk about the numbers of cases all we want, but it only takes one if it's your child. And so that's why their story is so important. Her 9-year-old daughter, Blair, was first diagnosed with a brain tumor in February. And then in July, her father died. And the mother believes that they got COVID at his memorial. And so this little girl ultimately ended up in intensive care and on a ventilator. And in a Facebook post, the mom said that actually the brain tumor was easier because there was a plan and there was this knowledge and this had been dealt with before. COVID in kids is really just such a new frontier. I want to read you something from that post. She says, "Look at my child. This is why people are afraid. This is why people beg for you to wear a mask. Who are you hurting by wearing one? What freaking rights are you losing because I sit here and watch a machine breathe for my baby you're out living? I can't visit with my other child because I'm here." You think it's funny that people are so afraid of a harmless virus, in quotes. And, you know, as a mom, I'll tell you, that just hits you because you look at this little girl and just what she and her family are going through. And the mom really wants people to see these pictures and to know that their decisions impact all of our children.
Wow, it's you know, I don't have children, and it's heartbreaking to see these pictures. And it seems so plain and easy to just put on a mask to protect all the kids that we may come in contact with. Kristen, do we know anything about Blair's status now? Is she doing better?
Right, and we do have an update, and that's a little bit of good news. Still no release date, but her mom this morning put another post on Facebook, and she talked about how she's been moved out of her isolation room finally. She's moving well. She knows how to escape her bed fast and is ready to come home. Mom says she's ready to get her here. Still not sure on a discharge date because she's still weaning from the sedation with methadone, and it's a slow and steady process. So far, though, she's pushing through and making leaps and bounds. And that just shows you, too, like how long the recovery is for some children who have been on a ventilator. And it's not so easy of, oh, you're off the vent, you're out of the hospital. I mean, she has to be weaned off of these heavy sedating drugs that she was given. And this is a little girl who already battled a brain tumor. And we don't know, and we can keep saying this, we don't know the long-term impacts. Kids are getting long-haul COVID, and so we just don't know what this means for them down the road, Aaron.
Yeah, all right. Well, we're glad she's on the right track, seemingly, right now. Kristen Dahlgren, thank you so much for that. I want to bring in someone who has firsthand experience now with cases like this, Dr. Tina Carroll Scott. She is the medical director at South Miami Children's Clinic. Dr. Scott, we appreciate you being here today to talk a little bit about the Delta variant and how it's impacting children, particularly in your clinic. What are you seeing with pediatric cases right now?
So we are seeing definitely an uptick at one of our local children's hospitals, Nicholas Children's Hospital. The numbers have pretty much been on par for the numbers seen last year in July, but they are seeing higher numbers as far as positivity rates, which now hover around 15.5% with their urgent care visits. And the number of hospitalizations may go up as time goes on, with the Delta variant being much more highly transmissible and more kids being infected. All of the children that have been hospitalized so far have been unvaccinated, half of whom were not eligible, and the other half who were. And the severity of disease or illness has been higher than seen previously. We also need to remember that MIS-C, or multi-system inflammatory syndrome in children, doesn't show up until a few weeks after initial infection. And so we could see an uptick in these cases as well. So although on a whole, children have not experienced the severe illness and death seen in adults throughout this pandemic, that could change as this virus continues to spread and more variants develop.
A lot of things to keep in mind there. I want to ask you, too, as we're watching this Delta variant, and it is continuing to spread, we're going into cold and flu season pretty soon here. What symptoms do you think parents need to look out for and be able to tell the difference between COVID, a cold, and the flu?
Yeah, so the common cold and COVID actually can share many of the same symptoms, and sometimes it can be hard to distinguish between the two. Both can present with cough, but cough is usually more prevalent with COVID. Sore throat is a common symptom with COVID and rare with the common cold. Runny nose can present with both, and COVID will usually cause more severe muscle aches, fever, sometimes even presenting with gastrointestinal symptoms like nausea, vomiting, or diarrhea. And loss of taste or smell, often without a runny nose or nasal congestion, is the telltale sign. We should be getting tested, though, regardless, and err on the side of caution to not continue spreading this virus in our communities.
We're out of time, but I want to ask you very quickly, how would you respond to a parent who says, my kid had COVID already, doesn't that protect her enough? Why does she need to wear a mask in school?
Yeah, I think the most important thing that we can do to keep kids who have had COVID safe in school is to get them vaccinated if they're currently eligible and to continue the masking. For those children who have had COVID and are not eligible to be vaccinated, they should also continue masking. I think the take-home message is that masking should continue in a school setting, regardless of what the policy is in one state. And I think we all have to take personal responsibility to do the right thing and to look at the evidence over the last year and a half, which clearly shows that masking drastically reduces transmission of this virus. And in my opinion, it's a small price to pay to protect a large group of children under the age of 12 who are not eligible to be vaccinated at this time.
And we will leave it there. Dr. Tina Carroll Scott, we appreciate your perspective today. Thank you.
Thank you very much.
There is much more ahead in our special coverage of children and COVID. Coming up, how are teachers preparing for the influx of students with the Delta variant surging nationwide? In a moment, we'll talk with the president of the American Federation of Teachers about what's happening across the country, plus the preparations underway in one of the states becoming the newest epicenter of the pandemic. The superintendent of one Florida school district with 30,000 students to protect joins us after the break. Welcome back. Let's take a look at one of the reasons that we're putting children and COVID in focus today, transmission. Now, if a young student contracts COVID, that child has the ability to spread it far beyond the classroom. They could take it home to their parents, who could then carry the virus to workplaces, to friends, to grandparents, and from there, it can spread into the broader community. And after that, if any of these infected people travel, it has the potential to spread across the country. This is one possible route of transmission and the reason that health experts are urging masks and vaccinations so strongly. And this deepening crisis is exposing an even deeper divide when it comes to protecting children. In Lexington, Kentucky, parents picketed outside one school just hours after a new executive order from the governor took effect. That order mandating all kindergarten through 12th grade students wear a mask while in school. In Broward County, Florida, another protest, but from the opposing viewpoint, parents are outraged there over the governor signing an executive order banning mask mandates in schools. Let's dig into this heated debate over masking a little bit more here. Joining us now is Randy Weingarten, president of the American Federation of Teachers, the largest teachers union in the country, and Dr. Carly Simon, the superintendent of Alachua County Public Schools in Florida. Randy, I want to start with you on this. You recently changed your stance on vaccine mandates for teachers, folks who work in schools. What's your logic and what caused the shift for you?
So, and let me just also say that, you know, we've had these meetings. First off, the Alachua superintendent is my hero, and I just wanted to say thank you to her. But we've basically, you know, met as a union, and my union last night, by unanimous vote of our executive council, has said we're going to work with our employers on vaccination policies, including, you know, if they want a mandate, that we're going to bargain, you know, the impact of that to make sure that it's, you know, just fair and it deals with the, you know, the exceptions like medical exceptions. But we're going to roll up our sleeves and work with our employers on vaccine policies. And the reason that we changed, you know, we do still think that voluntary vaccination in this polarized world is probably most efficacious. But the reason we changed was because of the vaccine, because of the Delta variant and how bad it is.
Plain and simple. Dr. Carly Simon, I want to bring you in here now to talk a little bit. Your school system there, Alachua County, Florida, you're defying Governor DeSantis' ban on masks in schools. Walk me through your thinking, your reasoning here, and whether you have seen any sort of fallout from that.
So what we were finding is that early on, we were starting to notice that our staff members were becoming ill and we were having to quarantine. And it was because we were having a mask optional summer. And based on that, and as the school year was starting and what we were hearing from our medical professionals and our Department of Health was that this was only going to increase. And so it started with me just mandating it with employees and visitors on campus because we needed to make sure that we can operate our school system. The next day, our board heard from these experts as well as additional experts from our University of Florida neighbor, and it was compelling, and the board voted 0. We have had, obviously, some fallout from certain families who don't agree with what we're doing, but the majority of our families and our staff members are very pleased that we're doing this because we're protecting them and we're allowing longer face-to-face instruction, and we're trying to hold out as much as we can to keep people healthy.
All right, ladies, I wish we had more time. I appreciate you joining us today. Randy Weingarten, president of the American Federation of Teachers, and Dr. Carly Simon, the superintendent of Alachua County, Florida Public Schools. Thank you both.
Thank you.
Now, with many schools already back in session and others getting ready to reopen, a lot of parents have questions that are simply hard to get an answer to. NBC News senior medical correspondent Dr. John Torres is back with us now to answer some of those questions. Let's run through them, Dr. John. First one, is it safe to have a birthday party for my unvaccinated child and his friends if all the adults at the party are vaccinated?
And Aaron, you have to remember what you just talked about earlier, that kids can get the virus, they can transmit it to other kids, and they can even transmit it to adults who've been vaccinated, although that doesn't happen very often. And so you have to think about the fact that this is a group of unvaccinated people and what you're going to do. If it's an outside birthday party where they're socially distanced, then I'm not too concerned about that. If it's inside where they're going to be next to each other, then everybody should be masked up just to make sure that they're safe, and they should social distance themselves as well. And so in cases like that, you can have the party, you just need to adjust the party a little bit, Aaron.
Quick question 2. What should I do if my child's school is not mandating masks?
You know, this is a tough one because you want to keep your child safe. And if they're not mandating masks, hopefully they still allow your child to go with masks. And so they can wear a mask when they go there, which is important. But also look at the other measures that they're doing. Are they social distancing kids? Are they doing a lot of cleaning? Are staff vaccinated? Look for those as well. And if worse comes to worse and they're not, just go ahead and do social distancing kind of education, do long distance education, Aaron.
Quickly here, our family is unvaccinated. How often should we be testing ourselves, and is a rapid test okay?
Yeah, the rapid test is okay, and think about what we did before, and that's the same thing you're going to do now. If you have symptoms, if you come in contact with somebody who has COVID, if you have any concerns, go ahead and get tested. You don't need to be tested on a regular basis, but if you have these issues come up, that's when you want to get tested, Aaron.
All right, Dr. John Torres, NBC News senior medical correspondent. Sir, we appreciate you. Thanks. And that does it for our special coverage of children and COVID, but our coverage continues 24/7 on NBCnews.com. You can get the latest COVID news from across the country and around the world. Plus, check out our interactive maps and track the latest data from your community. It's all at your fingertips at NBCnews.com/coronavirus. Thank you for being with us. I'm Aaron Gilchrist.